More than 2,000 Bay County residents were hospitalized in the past 3 years because they suffered a stroke. Ascension Sacred Heart Bay sees 400 to 500 stroke cases a year. And as News 13's Riley Lehman tells us, doctors say those numbers are on the rise.
A stroke occurs when blood flow to the brain is reduced or blocked. The lack of oxygen and nutrients causes brain cells to die in minutes, which can lead to brain damage or death. October 29th is World Stroke Day, bringing attention to the dangers and the importance of recognizing the symptoms. A loss of balance, lost vision, droopy face, weak arms or legs, and slurred speech are signs of a stroke.
I see a lot of patients who get some symptoms. They get the numbness, they have a little tiny weakness at nighttime. They ignore it, they go to sleep, wake up in the morning, and it's way worse. But by that time, it's too late to do anything about it actively.
Fewer people become disabled or die from stroke these days because of faster treatment times. When a call comes in, Ascension Sacred Heart Bay has a stroke team ready before a patient arrives. The team consists of radiology, neurology, ER, and a physician on hand. The first step is a CT scan to determine the type of stroke. A ischemic stroke is a blood clot that blocks an artery to the brain. A hemorrhagic stroke is a ruptured blood vessel that causes a brain bleed. The patient can receive a clot-busting drug during the first 4 hours after a stroke to break up the clot and reduce symptoms. People of any age can suffer a stroke.
I've seen young kids have stroke, and I've had 100-year-old patients as well. But obviously, the older we get, that's one of the risk factors.
Other risk factors include high blood pressure, diabetes, and high cholesterol. Drinking alcohol and smoking tobacco can also increase your risks of a stroke. Ascension Sacred Heart Bay is observing World Stroke Day with a Coffee and Clots education event.
We are doing this for World Stroke Day to improve our patient care and staff education to help prioritize these patients and the treatment they get. Make sure they get the best practice.
In Panama City, Riley Lehman, News 13, Panhandle Strong.
Dr. Khan says the most important thing to remember is timing, getting to an emergency room as fast as possible.